Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And 4 days ago, I had a busy day doing disability exams all day, and I thought I'd make a video about it because it pointed out several things that are pertinent. The first, as usual, everything I say reflects my own opinions based on my own experience and learning, and not the opinions of the Social Security Administration or any other medical body. Now, first off, why are patients sent for consultative examinations? Well, there are several reasons, but the most common is problems with their medical records. Social Security reviews patient questionnaires and all the medical records, and often they can make a determination that the patient either is or is not disabled from the records. However, sometimes the records are incomplete. For example, Social Security prefers that the records be within the past year and prefers a specialist's opinion. A lot of people become disabled, lose their job, lose their health insurance, and can no longer afford to see the doctor, so their medical records are out of date. Another problem is confusing or conflicting medical records, and I had a patient with confusing medical records I'm going to talk about. In terms of conflicting medical records, I had a patient in January claiming disability for blindness. Social Security considers a person blind if their best corrected vision is 20/200 or worse. This man's records that I reviewed before I saw him indicated from one doctor that his vision was worse than 20/200, but from another doctor indicated that one eye was better than 20/200. And I think that's why he was sent to me for another opinion. The person had a very serious disease in both eyes that was causing blindness, and it turned out that his vision really was worse than 20/200. Not only could he not read the eye chart, he couldn't even tell where the eye chart began and ended on the cabinet in which it's hung. Finally, if a person is receiving disability and certain things happen to them, like they become incarcerated, Social Security stops disability payments while someone is in jail or prison. When they're released, they must undergo another examination. This can lead to some pretty ridiculous circumstances, the worst of which was a young man who came to me who was born with no legs. He'd been receiving disability from infancy, but then his circumstances had changed and his disability payments had been halted. When his circumstances changed again, he applied to have his disability payments resumed, and Social Security insisted that he have a consultative examination, as he said to me laughingly, to see if his legs had grown back. I examined him and he had no legs, so I put in his record, patient has no legs at all, and I'm sure his disability payments resumed. My first patient of the day was scheduled at 8 a.m. and in the written letter that Social Security sends to all patients scheduled for a consultative exam, it says to arrive 15 minutes early. I can tell you, less than half the patients we see actually read that letter. As I've said before, keep your eye on the prize. If your disability claim is approved, you will likely be receiving tens of thousands of dollars. I'm sure anybody could read a 2-page typed letter for tens of thousands of dollars. Anyways, no patient showed up at 7:45 or at 8 a.m. or at 8:15. The next patient of the day showed up at around that time. and I had already begun examining them when the first patient showed up 47 minutes late. Folks, I've gone over this again and again. You want the staff and examining doctor to have positive feelings towards you. When the first patient of the day is late, that can kick the schedule off kilter for the entire rest of the day, 11 hours. Be sure you know where the exam will be held and be sure to arrive early. It will pay off. I had an interesting case of folie à deux, and this demonstrated several of the signs and symptoms of functional illness. Number one, as I've stated before, if a patient arrives with one splint or brace, they probably need it. Two, it's possible. Three, probably not, and I've never seen a patient with 4 splints or braces or more who actually needed them. Another thing I've discovered is that patients who wear splints and braces on the outside of their clothes when they could wear them on the inside, some splints and braces being impossible to wear under clothes, they probably have a functional illness. And I have a psychological theory for this. If you want to maximally motivate someone, the best approach is to have a carrot and a stick. In terms of being ill or healthy, we have a carrot to appeal healthy, and that's that we consider people who appear healthy as attractive and potential mates. Conversely, people who appear unhealthy or disabled are not that attractive. Second of all, in the animal kingdom, which human beings are part of, a predator will tend to go for the easiest prey, and that means the person or animal who appears to be sick or lame. So normal people with physical disease tend to conceal it as much as possible. Also, being ill or injured is unpleasant. People try to minimize it. A person wearing their splints and braces on the outside of their clothes is putting on an ostentatious display of disability, and that's not natural. After I'd taken the history, I asked this person to remove their braces, and they told me they needed to get their spouse to do it. I asked them to just give it a try so I could see what difficulty they had, and they immediately became angry. This patient wanted to appear disabled. Wearing splints on the outside of the clothing when they could be worn inside broadcasts to the world that the person is disabled. Asking the patient to try and remove their splints when they say they need assistance threatens their beliefs and is usually met with anger. Remember, disabled patients are sad. Functional patients are mad. In fact, the personality of functional patients often resembles that of a 2-year-old toddler. They are demanding and entitled. They want everything their own way. They want to be handed everything on not a silver platter, but a diamond-studded gold platter. An example was a patient who told me that they saw no reason why they should have to undergo an exam. Social Security should just take their word for it that they're disabled. When these folks aren't met with servile compliance, they can throw temper tantrums. Temper tantrums are bad enough. With toddlers, they tend to elicit disgust. Everybody's seen a 2-year-old or 3-year-old fall to the floor crying and screaming because their mother wouldn't buy them candy in the grocery store. and we feel disgust. However, when an adult behaves in a similar manner, we have 100 times the amount of negative emotion. It's a really nasty thing to see. If you read the comments to my videos, here and there you'll find examples of exactly what I'm talking about. People throwing temper tantrums because they don't get everything they want. Again, people who are truly disabled want to minimize their disability, and if asked to do something, they'll usually try. People who refuse to try are usually functional patients. In this situation, it's important to pay attention to your counter-transference. When we see a patient who's truly disabled and unable to perform an action, we feel pity. When we see a patient who is not truly disabled and will not perform an action, we tend to feel disgust. Finally, this person had complaints of pain in both knees, so while they were supine on the exam table, I palpated both knees, and then I wanted to see if there was bony crepitance. So I put one hand on the knee and then asked the patient to flex the knee as far as possible. And with each knee, they only flexed about 30 degrees and then said they could go no further. However, after the exam was over, the patient sat down in a chair with both knees flexed about 80 degrees. I told them that I found it puzzling that while I was checking their knees, they said they could only flex to 30 degrees, but while they were sitting comfortably, their knees were flexed 80 degrees. And of course, they got angry. In a similar vein, I saw a patient who appeared normal in the waiting room, and I asked them to come back with me, and they said that they needed their partner because their memory and thinking were impaired. Again, folks who really have memory or cognitive impairment tend to try to hide it, or they're unaware of it. And I've certainly seen plenty of disability patients with impaired memory and cognition. When a patient loudly proclaims their mental inability, it's likely to be functional. And sure enough, this patient exhibited no memory or cognition problems whatsoever and was able to give a complete history dating back multiple years. That brings me to the subject of brain fog. Now, in my experience, a lot of patients will tell me they have brain fog, and most of them just flat out don't. It's a favorite complaint of hysterics and malingerers because it's difficult for a physician to disprove. However, I certainly have seen patients with trouble with their memory or cognition or both. This is a current problem because many folks who've had COVID-19 are complaining of post-COVID brain fog. One helpful thing is to ask the patient what sort of job they had before becoming disabled, and then judge that against the cognition and impairment they display during the exam. I had a patient in December who had a very high pressure job that required superior cognitive and memory skills, and I could tell something was off during the exam, and the patient also reported they had trouble thinking and remembering. Often, I just can't tell if somebody's thinking and remembering normally, and in that case, I refer them for a psychological evaluation. Next, I've stated before that the more problems a patient complains of, in my experience, the less likely they are to be disabled. However, that is not a 100% accurate rule. I had a patient whose medical records were quite confusing because they reported all sorts of problems with the hands. And when I got to talk with the patient, they reported 4 different separate diseases and injuries affecting the hands. I was very impressed when I examined their hands. They had all 4 diseases and injuries, and each one was bad. They certainly were disabled when it came to lifting, carrying, and handling objects. I'm now in my 44th year of practicing medicine, and when I do Social Security exams, I'm constantly amazed that I see conditions I've never seen before or that are much more severe than I've ever seen before. I'd never seen a patient with 4 separate hand problems in both hands. Finally, I had a patient who claimed to be disabled as a result of an auto accident that had happened a couple of years prior. And when people tell me about an auto accident, I have a couple of questions to gauge the severity of the accident. Those questions are, did they break any bones? Were they admitted to the hospital? Here you must be careful because a lot of people don't know that an emergency room visit isn't an admission. I mean admitted overnight. And number 3, did they require any surgery? The answer to all 3 in this case was no. And it turned out this patient was malingering, and I'd like to go through the various symptoms and signs that helped me make that diagnosis. Number 1, when the patient walked down the hall and entered the room, there was a lot of dramatic sighing and moaning. I find this to be a real clue to functionality because, again, really disabled patients tend to minimize their condition. Number 2, they complained of neurologic problems that did not fit the wiring of the human nervous system. On examination, there was the typical overreaction to lightly brushing my fingers over the skin of the low back. That is a real clue to functionality. There was patchy, non-anatomic, non-physiologic loss of sensation in both arms and both legs. Again, it didn't fit the wiring of the human body. In gait and agility testing, I noticed the sarcastic laugh sign when I asked the patient to perform an agility test. This was walking on tiptoes, which I always demonstrate to the patient. A truly disabled patient will try. They may not be able to do it, but they will try. The sarcastic laugh sign is when the patient laughs sarcastically and says something like, "Yeah, right," or "That's not going to happen." And again, I don't think this is 100% accurate, but I have yet to see a patient who gave the sarcastic laugh sign who couldn't perform the activity I was asking them to try. Finally, in the heel-toe or tandem walking test, there was pronounced uneconomic posturing, and I'd like to go into that a little bit. Normally, humans and all other animals use economy of motion. We make the minimal motion and expend the least amount of energy to achieve our goal. For example, when you pick up a pencil, you don't yank it up with all your strength. You apply just enough force to raise the pencil to where you want it to go. This patient was feigning problems with balance, and if you've seen patients with physical balance issues, and I've seen a lot, you'll notice a couple of things. They're very worried about falling, and they probably have had falls and may have been injured or scared. They tend to walk with a broad-based gait, and they tend to keep the foot that's in the air very close to the ground, so if they start to fall, they can stop the fall. This patient kept the feet close together, windmilled their arms and leaned side to side and forward and backward in a dramatic way. That's actually more difficult than simply walking heel toe, and that's why the sign is called uneconomic posturing. As I've stated before, patients who are physically disabled are sad. They've lost part of themselves, and they try to minimize it as much as possible. It's painful to think of all the limitations they have and the things that they can't do now that they used to be able to do in the past. Functional patients are different. They tend to proudly and arrogantly proclaim their problems as if they're their prized possession. Well, I hope this has been interesting and useful, and as always, remember, if it happens, it's possible.